Root canal treatment can be your tooth's last chance for survival. So what exactly is a root canal? Simply put, it's the space in the center of the tooth that contains what is called the pulp, which is made of the tiny nerves and blood vessels that keep the tooth alive. It runs all the way down the inside of the roots, thus the term root canal. If bacteria enter the pulp, as it can from deep decay, the tooth becomes infected and needs to be treated. So, if a cavity has progressed so far or an infection is so bad that a simple filling or treatment won't fix it, the only option is to clean it out and seal it off. Root canal treatment offers a lifeline to a tooth that otherwise would need to be extracted. While the root canal treatment is never fun, with local anesthesia it can be a painless procedure that usually takes 1 to 2 visits to complete. How do you know if your tooth is in trouble? You'll feel intense pain while chewing or with hot foods or liquids. Cold sensitivity, on the other hand, is not always a sign of root canal trouble. The tooth pain is really bad and usually lingers for a while. If the pain wakes you up at night, it's almost a sure bet that you need root canal treatment. Sometimes the tooth itself might look darker, especially a front tooth, or the gums surrounding the tooth may become swollen, even showing a sort of pimple or abscess in the gum above the tooth. Occasionally, there's no pain, and a tooth in need of a root canal treatment can be tricky to detect, so regular checkups are key. If you do need a root canal treatment, local anesthesia is applied to the tooth area. Your dentist will make a small hole in the tooth and the pulp tissue is removed from the canal or canals within your tooth. Front teeth generally have 1 canal, while molars can have more than 3 canals. The nerve tissue is taken out because it can break down, causing bacteria to multiply inside the canal, often leading to a root infection called an abscess. Once the damaged pulp is removed, medication is injected in to destroy any remaining bacteria. The tooth is then filled with a paste and sealed off. In some cases, it can't be sealed until a second visit if, for instance, the infection was particularly bad or other anatomical or procedural complications make it impossible to complete in one visit. In these situations, a temporary crown or filling is placed over the tooth so it can heal for a few days. Because the structure of the tooth is a little weaker after root canal treatment, you usually get a crown made of gold or porcelain for protection. For a couple of days after the procedure, your tooth can feel sensitive and your gums swollen. Ibuprofen or aspirin should help reduce the pain. If your pain persists or returns, it can be a sign that an infection still exists, most likely in an extra canal that has been missed. Or there may be a small undetected crack in the tooth. Extra canals can be filled, resolving the infection and getting rid of the pain, but cracked teeth usually need to be extracted. For more information on the most common dental procedures, check out other videos in this series.